All right, so welcome to the Good and Well Soul podcast. I'm Daishan.
And I'm Kim. Thank you for joining us on this journey to physical, emotional, mental, and spiritual wellness.
All right, so today we have our very first, very special guest with us.
Yay!
Woo, 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 woo. And that is Dr. Kanika Turner. So today we are doing COVID questions with Dr. Kanika. I just love the alliteration there. I was actually thinking at one point about doing the alliteration with the letters, but then that would be 3 Ks, and that just
we don't want that.
We don't want that.
Not
so
good.
yeah.
No.
So Dr. Turner, should we call you Dr. Turner or Dr. Kanika? What do you prefer?
You can say Dr. Turner. I feel like people say Dr. Kanika, Dr. Turner. You can say Dr. Turner.
Dr. Turner.
All right.
So Dr. Turner is a native St. Louisan. She is a board certified medicine physician, family medicine physician with Family Care Health Center since 2017, and also associate medical director since 2019 at the Carondelet site. So you're doing big things if you are the associate medical director.
Trying to a little bit.
Yeah. Awesome. And you also have been a consultant for the Missouri State Opioid Response Team and helped build a faith-based opioid initiative to increase awareness in the St. Louis African-American communities of the opioid overdose crisis. So we thank you for all of that. And in addition to that, not only do you have all these roles, but last year in 2020, you were the recipient of the John M. Anderson Excellence in Mental Health Award.
Awesome.
So big ups on that. Do we still raise the roof?
Thank you.
I don't think we raised the roof anymore,
bad.
but congratulations. And
Thank
we're
you.
so happy to have you with us.
Thank you. I'm happy to be here. I love talking about this.
Awesome.
Yes.
Oh, great.
Yes. So when I met you via a work webinar, I thought, man, she is on the ball. She's doing the thing. I would say you're killing it, but since you are a doctor and you took that oath, that probably wouldn't be the appropriate response. But yeah, you are a young Black doctor, St. Louis native, and all of those things. So I said, we have got to see if we can do an interview. And it just so worked out. Someone that I was training with knew who you were and made the connection. So we're so glad to have you as a guest on our podcast.
Yeah, I'm glad you reached out. Yeah. I said that was a huge call. So yeah, I'm so glad that you reached out, because I always love helping and
Awesome.
sharing some information and talking about this.
Jinx. Well, I appreciate you so much for saying yes. I get the benefit of Daishan coming home from work, and he attends all these webinars, and he comes and tells me, and guess what else I learned? So I feel like I get a little double benefit as well, although I did not attend the webinar. But he spoke really highly of it. And so we're excited to have our very first guest on the Good and Well Soul podcast. One of the most recent episodes we did was just kind of talking about how we felt about COVID and how it has impacted us. And we'll probably go into that a little bit later. Yeah. But I think it's really great that we're able to follow up that episode with a doctor in St. Louis that can really share more of the medical expertise side of it, along to go couple that with our own narratives and our personal journey as well.
Absolutely.
Okay, well, he's from Chicago. I'm from St. Louis. So
Yay.
I know, right? As the native St. Louisan, I have to ask you this question. You could choose not to answer, but where you go to high school?
Hazelwood Central. I knew it was coming. I was getting ready to jump in there. But yeah, Hazelwood Central. That's where I went. Yeah.
Okay. My brothers went to Hazelwood Central. So, okay. I went to Lutheran North.
Okay.
So,
yeah.
All right. Well, we got a hawk in the building.
What year did your brother graduate? I wonder if
Let me see. I'm 01. So I would say they were there like 06 graduate, 07.
Okay. I was 03. So they probably could have been maybe freshmen. So I may not.
Maybe.
I don't know. Okay.
One of my brothers was on the, what was that called? The advisory, whatever, the student council thing that you all had, the news, but it was like that they would do the news.
Okay.
I don't remember what it was called, but
I don't even remember that.
I just remember that it was like a low key news for Hazelwood Central, but it would come on the regular cable channel. So we'd be looking. Like,
Yeah.
Okay.
this has to do with Hazelwood, nothing to do with us, but we're going to look because he's on TV.
Yeah.
All right. So,
All right. Well, we're going to dive into the questions now that we figured out which high school you went to.
that's very important information to start with.
No one ever cares
It
where I
is.
went.
No
It's
one
okay.
cares. No one knows.
But I came after I graduated from high school, and I've been in St. Louis for 20 plus years, so this is home
Oh,
to me.
really?
Yeah.
Yeah.
I have recruited him to the Cardinals, Mizzou Tigers, the Blues, everything. I mean, he's basically, this is home.
Yeah.
This is home now. Yeah, this is
Absolutely.
home.
Absolutely. So, Dr. Turner, one thing that we wanted to ask you, just first and foremost, what has your role been in this COVID pandemic as a physician?
Right. So actually multiple roles. So, so on my family care hat with, social medical director, it actually required a significant amount of changes just in the clinic, just working in the healthcare system. We didn't do telemedicine at my clinic. So, myself, we have another social medical director at our other site and our chief medical officer. We're doing a lot of work at trying to, stay on top of getting providers up to speed on how to do telemedicine visits. We had to quickly switch in-person visits to doing it by virtual. And if you've never done that, I mean, you have to learn how to do a physical exam by video, so it's kind of like you on the fly, you have to learn something that we wasn't really exposed to. I think the other thing as well, my location, we set up to do COVID testing for the community. So we had to quickly get a schedule together. We had to learn how to do the testing, get, all of our staff. And, and don't get me wrong, there were some staff that didn't really want to get that close. So I definitely, we respect that. But just the day-to-day changes with COVID. And at the very beginning, I mean, it was, you can say one thing one week and the next week is something completely different. So just like staying on top of all of the knowledge and the literature, and, it was so much stuff that was changing. So it's kind of like, when you're in a leadership role, people are going to come to you. They're going to ask you your opinion, your questions on this. What do you think? And like I said, one thing will come out Monday, you come back and check 7 days later, it's something different now. Yeah. So I think just with, personally just following all of the medicine and feeling comfortable being able to regurgitate the information, interpret information for people. And then just within the system, completely revamping and helping other, MDs, NPs, nurses, everyone transition to being able to do telemedicine and just all the changes. I would say the other thing too, just, a lot of people, just the stress, we had people, family members got sick, staff was getting sick. So then we had an issue just with not having enough staff available. So it was a lot of things internally that I think, we'll be able to look back on to learn just from a clinical practice perspective. I also round at the hospital, so I deliver babies. So I love what I do. I'm family medicine, so I do everything. One of my mentors said that with family medicine, I take care of you from the womb to the tomb. So I adopted that and stole her little her phrase. But just even with that, I continue to round on the hospital floors, work with the residents with teaching. And so, we did have some moms who tested positive with COVID. And so it's kind of like, you have to know how to navigate that as well and feel comfortable. And at that time early on, our teaching residents wasn't allowed to, be up in front and taking care of patients. So a lot of stuff fell back on us as attendings, but just the hospital system changes with, being up front. And then I would say on the other hand, that's more so clinical stuff I do with working. But on the community side, I do a lot with the churches. I work a lot with clergy coalitions. And so a lot of churches had to close. And as a result, I started helping a lot of churches how to, we created this little series with Behavioral Health Network and the Missouri Mental Health Board. I don't want to get it wrong.
It wasn't MIMH, was it?
Yeah, the I'm not saying Missouri Mental Health Institute.
I believe that's
she's
what
gonna
it is.
kill me for not getting her organization right. But we, a lot of churches was also seeking information. This was the first time in the spiritual community, you were being told not to socialize, not to get, that close to one another. It wasn't safe to congregate and gather. And that's all about, that's the root of when you're at a church, that environment, being around people, worshiping with people. And so for that, a lot of churches also, I assisted them with kind of going through this, navigating this as well. How can they stay safe? There were some that didn't want to close at all. And the idea was we wanted to help churches to continue to feel spiritually connected while maintaining that physical distancing. So it was a lot of education that went early on to pastors and bishops and mothers, anyone in the church community who needed that information. So that was another part, with doing weekly podcasts, weekly interviews. And, a lot of pastors have my phone number, which was fine. I want everyone to stay safe. And now we're kind of transitioned to a lot of them are reopening, things are a little bit different now, but at that early on part, it was a lot of misinformation. It was a lot that was going on. And this was something different for the church community too, being told to shut down. So those were my two hats, clinical, and my other part was in the community.
I think that's great that early on you were dispelling a lot of the myths because they were swirling around, and like some of them I was believing, some of them I was like, that's foolish, and then you're up at all hours of the night. I know at some points Dashawn was like, go to bed, don't read another article, close your eyes. I'm like, I can't sleep. He's like, because you're staring at your phone. You need to close your eyes.
But you know what? But so many people experience that. I mean, I tell people now with the pandemic, I've treated and seen so many people with new diagnoses of depression, anxiety, PTSD, and a lot of it just that stimulation from watching the news every day. And especially at the beginning, we want to talk about how the media did this. I mean, it was a fear. I mean, it was a fear tactic. I mean, and I get it. It was something new, but the information that was being given, the daily reports, you seeing the death count. I mean, it made you afraid to go outside.
Oh, absolutely.
Yeah.
Absolutely. You mentioned, were you going to say something?
Oh, no, I was just going to say one thing that stood out to me was I never thought that an illness would be so polarizing, just nationwide, worldwide. And it seemed like it divided us up in so many different ways. So that's just what stood out to me with the misinformation.
It is. I mean, and it's interesting, for me, public health perspective, clinical perspective, it's a no-brainer. This is a virus that's devastating our community, but I agree. It was so polarized. It was politicized, which, a health issue should never be like that. I mean, even it was a political statement about whether or not to wear a mask and what that meant. If somebody didn't wear a mask, it was automatically tied to Trump, so it's kind of like, it was so much in that, I mean, I had patients coming in to me asking me, I would say a lot of that, and people believed a lot of that. And I get it. If that's your source of information, this is somebody that's representing the United States. Of course, the big thing with using bleach. I mean, it was a mess. I would say he put out a lot of false information that some of us on the individual level had to clean up and deal with because patients were coming in saying, hey, the president said this. It's kind of like, don't listen to him. But but I mean, it was a lot. I agree. It was a lot of just myths and a lot of things that were circulating. And it's still today. I mean, we still now with the vaccines, there's so many different myths, so many things that are circulating. But early on, the media played a huge role in a lot of that. And the ripple down effect was it affected people's mental health. It had so many different effects on people. And especially, for family members who lost their loved ones to COVID, this was just a trying time last year. Then, of course, George Floyd, 2020 was a year we'll never forget.
Yeah. And when you talk about those ripple effects, that's one thing that we're realizing now that, COVID wasn't just the virus. Like there were so many other implications and things that have come out of this pandemic. You talk about the telehealth. So I had a doctor's appointment early on because when COVID kind of hit widespread, I was in the middle of allergy asthma season. So I was struggling and my doctor was like, well, I'm not going to see you. And she had to do a telehealth. I think I was my doctor's first telehealth patient because it was just, I mean, I was like, what are you doing?
It was difficult.
It was.
You've never done that, it was difficult because not only that, we had a new template. So our EMR system, electronic medical records, if you've never done telemedicine, so now you have to learn how to document a visit appropriately. Then it was issues with insurance companies. So, I would say for me, the biggest thing too that came out, the digital divide. So you had some people who had a smartphone that can access it.
Yeah.
You have some people who didn't. So for people who, we couldn't safely bring them in, we had to do this as a phone visit. But then you have all these different insurance carriers. Some wanted, it had to be video, at least 2 or 3 minutes of video. If not, you couldn't charge a telemedicine visit. So there were so many different things you had to learn. And if it was video, you had to learn how to document a physical exam. We're used to being hands-on with touching and listening and, with being able to come up with our diagnoses. But it did challenge you as a physician to be able to listen, to get a very thorough history, to do a video physical exam, to be able to treat appropriately. And it took some time, but you'll get the hang of it. But if you've never done that, that's something brand new. And in all these different clicks and, the other thing, if people need a labs, I had one that was really, I had a patient that was diagnosed with breast cancer during this time. Oh, wow. And, originally it was, so it was really sad because, a lot of elective procedures were canceled. So colonoscopies, mammograms, a lot of things were canceled at the start of this. So we couldn't even get her in. And when we finally did get her in, it was actually, diagnosed with breast cancer. So even just thinking about that aspect, that because it created a halt in our medical system, a lot of elective procedures or screenings that probably would have been able to pick up a lot of these things, we had to wait. It took a few months to be able to get her back in. So it's kind of like it was so many different avenues that, that affected so many different people, just the healthcare system. But it did teach us our healthcare system is not perfect. It's filled with so many flaws, so many different areas that we need to work on. And, this pandemic definitely, unroofed a lot of different things.
Well, I'm definitely glad that those things have been highlighted because I think the telemedicine and telehealth coming out of the pandemic is something that's here to stay and actually can be beneficial. Now, my 3-minute phone call with my doctor, and then when we got done, she was like, okay, so-and-so in the office is going to call you for your payment. I was like, click. I'll see if I answer when they call me because you checked on me like you were a friend. Hey, how you doing, Kim? You good?
And a lot of people, so actually we have to start getting consent. So a lot of people, that was happening. And at our clinic, we used to call patients back. But now it gave us the opportunity you can do as a telemedicine visit, but you have to get consent from the patient. Are you okay?
Yes.
If I convert this visit to a telemedicine, you may have a bill. But I think some of our patients were used to, us calling back at the end of the day, and it's just a regular phone call. So once that came into play, we have to educate patients. Like, this is a telemedicine visit, whether it's phone or video. And of course, if patients said no, we didn't, bill it as a telemedicine, but we had to get consent. Are you okay with us having this visit as telemedicine? And I agree, is the copay, scheduling follow-ups. That was another thing too. People wasn't answering the phone to schedule follow-ups. Definitely copay, getting that collected. And we didn't do anything. We wasn't this up to speed as some of the other like hospital systems. If you went to like an outpatient care, you can do everything electronic. A lot of the FQHCs, so community health centers, we wasn't even set up to be able to receive payment over the phone or, get it over the internet. Like we wasn't set up like that. So that was something new too that came out of this, the way we collect our copay and do our pre-registration process.
Yeah.
So you talked about there were a lot of changes. So you were here one thing and then come back the next day or the next week and there's something different. So now here we are. We were hearing wear your mask, social distance, wash your hands. And now all of a sudden,
mask off.
Take your mask off. I'm walking around Target. I text my husband like, I don't think we have to wear masks in Target anymore because normally, before it was like that one person that was like, I don't care what they say. Like, I'm going to walk around anyway. And then I was like, it's so many people and I don't hear the reminders over the intercom anymore. So, Dr. Turner, is the pandemic over?
When that announcement came out, I have so many issues with
the CD. You're talking about the CDC announcement
CDC.
For fully vaccinated individuals.
Yes. Because here's the thing. If you really look at the numbers to break down on which communities are getting vaccinated. So they said that we need to reach about 60-70% for herd immunity. And what that means, herd immunity, is that either people had COVID and recovered, so you have enough antibodies, or you get vaccinated and you haven't hit anybody. So pretty much that's one way to kind of minimize or decrease the spread of the virus. But if you look at the breakdown of who's getting vaccinated and who's not, unfortunately, in our Black and Brown communities, it's only about, anywhere from 15 to 30% vaccinated. But if you look at majority white communities, yes, they're getting the 60, 65, 70%. So for these premature guidelines to come out saying it's okay to, take your mask off if you're truly vaccinated, then they rely on somebody to voluntarily say, I've been vaccinated, I can take my mask off. But
The
for me,
honor
it makes
system.
me so concerned. Yes, the honor system. And it makes me so concerned because even those states who have lifted, with those countries that have lifted that mask mandate, wearing a mask, they're seeing a surge in cases. And of course, we do know which communities were those that were most impacted, the Black and Brown communities. And we're the least to get vaccinated right now. So there's still way more work to do. So I tell people, continue to wear your mask. If you're out and if you're at your house, not you can trust your family members. You're at your house or something, everybody's been vaccinated. That's one thing. But just going out to restaurants, out into the mall, back to your daily lives, like we're not in a pandemic. I caution people with that because you don't know who's going to wear a mask, who haven't. I mean, we even saw that. It was such a debate about wearing a mask. So
Right.
Now you want to believe somebody about saying that they want to get vaccinated. Then there was a debate about getting vaccinated. So it's like, who do you believe? Protect yourself, protect your families if that's the best thing to do, because we do know wearing masks is protective. So we do know that is a fact.
Yeah. Yeah, that's good. So Dr. Turner, how would you say that the COVID pandemic has affected you personally?
Yeah. So I share my own personal story with my patients. And so for me, I did actually contracted COVID in November. It was pretty bad. And it was, I rounded at the hospital on a patient that Monday. Both myself and the patient tested positive that Friday. Had PPE on, did everything that I was supposed to do, that I was doing right, wearing my face shield. That time we were wearing face shields and N95 masks. So it wasn't just a surgical mask, I was protected. And it was really sad because I also gave it to my daughter. Somehow my husband got out of it. So just my daughter and myself, we were the ones who were sick, and he stayed away from us, which was fine. But it was, two things for me. Thankfully, my mom had a doctor's appointment and I almost was the one that was going to have to take her. Wow. Thankfully, that doctor's appointment was canceled because, of course, I'm in the car with her. Even if I had my N95 mask on, I was asymptomatic when it first started out. So my symptoms probably developed. So I got exposed on Monday. Typically symptoms will develop anywhere from like 4 to 5 days after exposure. So I didn't know, my daughter got exposed to it as well. So both of us started developing symptoms on Thursday. And I just felt tired. And I thought it was more so because I was rounding, I was doing a lot. I just feel really tired. And my daughter was playing basketball at the time. So when I picked her up from basketball practice, she felt tired. Both of us just thought we thought like we're doing so much. She just finished practice. She's studying a lot of changes. We go home and relax. When we woke up Friday morning, I literally felt like a ton of bricks fell on me. I felt so bad. And when I walked around to her room, she was like, I don't feel good. Like she had a sore throat, headache. And I knew it. I was like, we've been exposed. So of course I told my husband, don't come by me. And thankfully that night he actually slept on the couch because he fell asleep. So like he wasn't even upstairs next to me. But it was sad. I mean, how quickly our symptoms started. And my daughter, she recovered. We got tested on Friday. Our results came back Sunday. We both were positive. And she actually started to feel better after 2 to 3 days. She was back to feeling herself. But for me, I was the full 2 weeks. And even now, I tell people I still experience some of the long COVID symptoms, but I had a lot of nausea, vomiting, diarrhea. I couldn't keep anything down, muscle aches. I had complete loss of taste and smell. That took about I think my taste slightly came back like right before Thanksgiving. So I just got out of my quarantine, couldn't really enjoy Thanksgiving meal. Like it was like a subtle taste that came back. My sleep was thrown off. I had really bad insomnia. Like I remember one night I was laying in the bed, it was like 4:00 in the morning, and I just woke up out of my sleep and I don't know if you all ever studied for like a really big finals or exams. Like I felt mentally exhausted and I woke up out of my sleep and I felt like I had just finished studying for a test. Like I felt exhausted and I was asleep. And I think that was the night when whatever took place with my sleep, that's what I've been experiencing. So I've been taking melatonin every night. I did have some issues with brain fog. So at the end of the day, when I first went back to work, after a long, busy day, I couldn't even like really get through all my notes because I have to take notes, write down things. That brain fog that set in, I mean, it's real. It literally felt like my mind was blank. I could remember things, but it was just like, it was so foggy and just, I didn't feel right. But once I went home, I'll rest, lay down. The next day, I'm okay. But it did affect me with taking call. I had to have my two of my colleagues to take calls starting at 10 o'clock because I was on melatonin. So I didn't feel comfortable driving overnight. You get called in, anytime for OB. Mm-hmm. So it definitely affected a lot just with my work behavior. A lot of my colleagues had to step in, like I said, help with being on call. And just now, things are slowly getting better. Definitely sometimes I have the brain fog. If I'm, been on call or working 12 days straight, I can experience it. And then the insomnia, if I'm really, really tired or exhausted, I have early morning awakenings. I probably sleep like 6 or 7 hours. Can't take naps anymore. So definitely I tell people it's no joke, it's no joke.
Yeah, that was one of the things that really hit me about COVID was the long-term effects and just kind of how it lingers and how the recovering process might take time, even though you are no longer symptomatic in the main ways that everyone knows about, or, you finish your quarantine period. There are still some things that stick with you for a while.
Yeah, it definitely does. I mean, I know of some people, lost all of their hair. Some have heart failure. So some older patients of mine that I know, heart failure as it relates to it. Definitely have some just have, constant nerve type pain. Mm-hmm. So definitely, some still have some pulmonary symptoms. So may experience some shortness of breath still. So yeah, those long COVID symptoms. And the thing is, there's no actual treatment, and we're still trying to figure out, how long will it take to recover? I said, for me, it's hitting 6 months. That was right at May. And I feel like that was the first time where I felt like, okay, I'm feeling a little bit better. There's things we can encourage: exercise, healthy eating, physical therapy if we need to. We can have, some medicines that we can try to use to help with some of those symptoms. But for the most part, you have people that's going to be dealing with this, and we don't know right now how long all of these symptoms will last. We just don't know.
Is it still beneficial for someone who has had COVID, recovered from COVID, developed antibodies? Is it still beneficial for them to consider getting the vaccination?
Yeah. So I got my vaccine. I had COVID in November. I got my vaccine in December. So a month later. Mm-hmm. I did have some antibodies at that time, but when Pfizer first came out, we didn't know what the supply was. At that time, we were told that antibodies only good for maybe 90 days. And that was pretty much my opportunity to be able to get the vaccine. So I went ahead and I got it, at that time when it was offered to me. But even so, like I said, we're still learning how long will these antibodies last. Now we're saying 6 months. We don't know, will this COVID vaccine be something that's seasonal? We do know the virus has mutated. So there's different strains or variants that's out. So there's multiple different things that come up. That it's not just, the same virus at the beginning. It's the same coronavirus, but it has mutated itself. So now we're dealing with different variants right now as well. So if someone is interested in getting the vaccine, I always talk to them about it. And then Ray, the risk and benefits. We don't know what will happen if you were to get COVID the second time. There are some reports that it can be worse the next time around. Mm-hmm. So you have to think about that as well, moving forward also.
Yeah.
Thank you for sharing that.
That's huge. And my hat's off to you. For you to have been there almost ground zero. Would you say you were ground zero?
I will. Yeah, I was thankfully, I think if I wouldn't have been a doctor and kind of knew how to take care of myself, I probably would have ended up going to the hospital. Like, I had to call to get some Zofran for nausea sent in. I had to, my husband was getting fluids, so I could at least try to take down fluids. And I will say I did get some labs checked, like in January. I had a little bit of kidney damage that went away, but still I probably was dehydrated. But, I think I knew how to care for myself, but mm-hmm. I can tell, I think if I didn't have this knowledge, I probably would have been somebody who went to the emergency department or something to get fluids or something. Because like I said, I couldn't keep anything down for a good 3 days. It was coming out of one of the other ends, and it was bad.
Yeah.
It was bad.
I think that's awesome that you served, you got COVID, and then you went right back. So I think that's just amazing. So thank you for being a faithful medical professional?
I like to share that story because sometimes, I think it gave me a different perspective too. At first, I was talking about, medical and this is what we need to do. But now I can also talk from a personal experience. I get it. This even the isolation. I would say that affected me too. I'm used to, we have family nights, we're watching movies or watching TV, and but just that isolation, it affected me as well. I was in my room for 14 days trying to find stuff to do. We did some unique things, like we downloaded the Uno app. So my husband downstairs, my daughter in her room and mine. So we, was trying to play the Uno app. My husband was like bringing little stuff, leaving it by the door and running away. So it's kind of like, if somebody didn't have that, like that mental health piece is so huge. I couldn't sleep. And then it was like, I had a TV, I was watching TV, but it was just like being in the same room for that many days, going, bathroom, back to the couch, to the bed. Like that was what I was doing for 14 days. And it's just like that can take a toll on you. And it did. So it definitely, I couldn't wait to get out of quarantine. Because I mean, that was, I can see how, when people really talk about the impacts of quarantine, we had to get creative at, keeping ourselves busy, keeping myself busy. I never really did games on my phone, but I found that to be something that kind of kept me going. I got back into reading. So it was kind of like, for some people who may not have access to the technology or access to that family support system, if you're quarantining at home, like it definitely, I was able to relate to a lot of more patients on a personal level, in addition, with the clinical level.
Yeah. That's good. So one question I want to ask you in terms of just where we are, where we stand as a state, as a nation. I was looking at the Missouri COVID dashboard, and I was looking at the CDC and their stats. So Missouri was saying that we have about 42% of people who have initiated vaccination, whereas the CDC says the nation has about 50% initiated. Missouri has 34% completed, whereas the nation has about 40%. So, I mean, I know you were saying earlier we need to have 60, 70%. Should we feel secure with where we are now? Are we doing good? Do we have an A, B, C, D? Where are we with that?
Yeah, there's still a lot of initiatives taking place. So I do know. So I would say so COVID testing, I think, at the beginning, that was an issue, worse availability of testing. I do think we probably missed a lot of diagnoses, a lot of cases because people didn't have access to get tested. So of course, we're quarantined, our people just didn't want to come out the house, to get tested. So that was an issue at the beginning, just access to testing. We've done a great job with improving access to testing. The turnaround time is a lot faster. It was taking up to 14 days to get results back. So on that aspect, I think we've improved with testing. And then a different type of testing, definitely was issues with the hospital systems run out of tests. And so even now, there are hospitals that are doing, COVID testing on admission. So that's a way to protect the hospital staff, way to protect, even just the patient, because when you get admitted, you may not know, but now the tests are so much better at being able to detect it. So I think on that hand, we've done a good job with navigating the testing part. The vaccination part, definitely a lot more work we need to do. I mean, there have been some creative ideas. We're partnering with churches to get the vaccines out, some mobile outreach, getting the vaccines out as well. The messaging. So that's the biggest thing, just to be honest, people in the Black and brown communities don't trust the vaccine. I mean, we know that. And there's a reason not to trust it. I validate that. I always listen to all the concerns, because if I didn't, or if I try to dismiss that, I wouldn't be a good human being if I did that. I mean, there's a lot of history there. We can talk about that, of course, that has led up to this, that has created that mistrust. And I don't like to put it on the Black and brown communities. It's actually the healthcare systems, the systems in place, the systems and structures in place that's supposed to care for the people have failed our communities. And so knowing that our system is broken, it's flawed, we need to fix that because it's not equitable. So now there's a big push. How can we make sure that vaccine distribution is equitable throughout the community? So I know it's like St. Louis City had their mass vaccination events at the Dome, and then St. Louis County have theirs partnered with St. Louis community colleges. So there's been unique ways to really get the message, the information out. There's been partners with, clergy members, celebrities, radio stations, to really get, information out as well. But at the end of the day, it's up to the individual to make that choice. And I think it placed, it was a very fine balance because, you wanted people to be able to feel empowered to say whether yes, they want to get the vaccine or no, they don't want to get the vaccine. So a lot of Black-led organizations didn't completely, back vaccinations because of that. We wanted people to have that autonomy. We didn't want to see what happened years ago happen again. You should never feel forced to make a decision, especially no matter what it is with your healthcare, whether it's mammograms, pap smears. It's up to us who have the information to relate it in a way to where you can make an informed decision as to whether you want to get the vaccine or some test or some procedure, or if you don't want to get it, understanding the risk and benefits related to the decision and answering any and all questions. Like that's what we need to move to. So with the vaccines, there's also been, people get the first dose, not going back for the second dose. I think with that, some education needs to be done. Some people, when they, may experience some side effects from that first shot, coaching people, helping them to understand, this can happen with this first vaccine. If you just take somebody, they're just getting a vaccine, stuff happen, they think they got COVID, nobody explained to them what to expect when you get a vaccine, that can definitely deter anybody from wanting to go back and get that second shot. So definitely a lot of messaging around it. It's sad to say we don't have too many providers of color. So it's always, we are always, considered trusted messengers, but being able to relay that information in a way, and I would say some of my colleagues didn't trust it, which I get it, definitely there's nothing wrong with that. But for me, I felt like I needed to follow the evidence as close as possible because having a medical degree, now I'm in a position to be able to understand that same information that's being presented at the CDC meetings or the World Health Organization meetings. And it's up to me to be able to translate that information, interpret it, and take it back to my community. So that's why I wanted to follow it so closely, just so I can be able to do that information. And I wanted it firsthand myself. I didn't want to have to rely on somebody else telling me the information. So, I will attend webinars. I will actually go back to some of the articles that they reference and, check the CDC, check the World Health Organization. Like I wanted to verify I was receiving accurate information because I don't want to be talking to somebody and I'm just repeating information I heard from somebody else. I wanted to be able to not only explain it to myself, but be convinced and know that, okay, I feel comfortable explaining this information, talking about it in this way, and not just repeating the information I heard from somebody else. So it was a lot that went into that.
I think that is an important point that you made about you were talking about for yourself, wanting to not just get the information, but be able to interpret it, understand it, and then explain it to someone else. And I feel like as an African American, a lot of times in our community, when we are going to these doctors, we don't get the time that it takes to actually sit down and explain what's going on. Sometimes it's almost as if well, you should just be glad that I'm here servicing your community right now. So just hurry up and do what I say. Let me shuffle out and get to the next individual. And for me, like, I need you to explain it to me in a way that I can understand it. And if you can't do that, then you're horrible at your job. I don't care how many degrees you got on your wall.
Yeah.
No, I agree. Explaining that information, and I always empower people, ask questions, bring questions to the appointment. So to me, I always empower people, no matter who you're seeing, always bring those questions. This is your body, you're responsible for making decisions. Nobody should ever make anyone feel forced for any type of medical procedure, medical treatment, medications. Ask those questions. What are the risks and benefits? What are the side effects of this medication? What will happen if I don't take this medication? What will happen if I do? Those are important questions. And I will say that traditionally and historically in medicine, it's always been this paternalistic type, I'm the doctor, do what I say. And then you get doctors who say providers, because, I am going to include nurse practitioners in there. They get upset if somebody don't want to follow the treatment plan. I'm putting that in quotes. But, there's a reason why. I always, when I do teaching to medical students, there may be a reason why somebody, diabetes is continuing to, the A1C, what we look for is elevating. And a lot of times, maybe it's all the way down to the point they have to decide between buying insulin and buying food. Medications are expensive. If somebody is unhoused, don't have anywhere to stay and they're on insulin, that requires a refrigerator. Of course, you're not going to do it. There's always things that could be there. Maybe it can be transportation or, they just don't understand. They can't afford to get it. And then you have some people who may not want to take because they don't understand, why was I just prescribed this medication? So it's always important. I always empower people, do your homework. Look, I have patients that come, I just Googled this. And of course, in the back of my head, I'm like, all right, Google.
Here we go.
But I like it though. That lets me know that you're taking ownership of your health. You're in tune with your health. Ask me those questions. And it's up to me, to be able to, when you walk out of my office, I want you to feel empowered and not feel forced as to why, what we discussed. I don't want you leaving confused either,
Writing down questions before you go, that's my thing. Like, I make sure I have my questions written down in advance because I want to also respect their time. I know that they have other patients that they're trying to see, but I don't want to leave and get in the parking lot. And then I'm like, oh, I really wanted to ask, whatever. So let's kind of switch gears a little bit. We talked about at the beginning about how polarizing COVID was and how, people were kind of associating the anti-maskers, as I call them, with the Trump administration.
Mm-hmm. Yes.
And I don't believe that it's all the Trump administration. I'll just say that because some of people that I know didn't vote for Trump running around here without masks on. I'm not going to call any names, point no fingers or elbows, but y'all know who y'all are listening to us. You know you ain't wearing your mask. So President Biden, one of the things he said when he first started, when he got elected, he was like, I want to have, 100 million Americans vaccinated within his first 100 days. So I think we're right at 200 million now?
Yeah, in 92 days, he got up to 200
million.
Okay,
so in 92 days, he got up to 200 million. Do you feel like his administration has necessarily had an impact on the pandemic? And if so, I guess I would say, how has the new administration had an impact on the pandemic?
I would say his administration, if we want to compare it to the Trump administration, definitely I would say I think it's more so a positive impact. I do think there are some areas specifically when we think about equity. I know he, has tried his best with, forming his equity committees and, making sure that the vaccine, the distribution goes out in an equitable fashion. But, if we think about what the previous president, was saying at those briefings and, false information being given, and then we come, fast forward to his administration, I will say it was more supportive of the science, more supportive of letting scientists and physicians and, those lead this. Like I said, my biggest thing now, I think just with the recent CDC updates, as far as with the, now you can no longer wear your mask if you're vaccinated. I really feel like they should have, I don't know if they did or not, consulted or talked to those, some of us in the, Black scientists, physicians who are in the community before releasing it. I had watched the news, the press conference with the CDC director. And it was no consideration for equity. What about, like I said, the Black and brown communities, when we look at this, male and female, the different ages, there's more than just, okay, we reached a 60% herd immunity, but you have to really look at, well, who's reached herd immunity? Which communities, we may need to support, so to me, I feel like that wasn't done. And unfortunately, that is under the Biden administration. That part wasn't done. But I will say he brought more of a positive tone to the pandemic compared to the previous administration. And there's less divisiveness. I do think Trump did not listen to the scientists. With Fauci coming out, who want to attack Dr. Fauci? Like, he's been around for decades. And it was attacks on somebody who's led us through, HIV pandemic, through, so much stuff. And this doctor is being attacked by the president. Like, it's just, that blew my mind, with that. So I do think that Biden has been more positive, but I do think that there are some other areas that, his administration can work on, specifically with the vaccine rollout, with this, and now, how we're continuing to deal with the pandemic.
Okay.
Yeah.
Well, thank you.
That's awesome. I just want to say, Dr. Fauci, he became my dude throughout this pandemic. I was just hanging on his every word.
Yeah.
It's so funny. I've had some patients, like we'll be talking like, yeah, Dr. Fauci said this isn't it. And it's so funny how is people trust him, which I get it. I was listening to him too, but it's just so funny. No one knew who he was, pretty much if he wasn't, in that space. And now people are like, Dr. Fauci said this, he said this. It's just like, okay, all right.
I know. No matter what was happening, I'm like, well, what did Dr. Fauci say?
Yes.
Or what was his face looking like during the press conference? Right.
No, I agree. But, it was sad. Like, But if you also pay attention, I said the media is so powerful. If you pay attention to, when it first rolled out before we knew which communities were being impacted, I mean, it was like fear, and it was pretty much really only talking about a lot of the deaths, and I get it. But then once you started seeing where the inequities or disparities were, the media kind of let up a little bit. It was at first, it was every day, the death toll, this is the net. And once you started seeing that the Black community was being impacted, I felt like there was a shift in the tone in the media. They started to spin it a little bit. And I get it, there was more people surviving than dying, but at the beginning, that tone, that sense of urgency, that, that's what you heard. And then once it changed and you saw which community was being affected, then that tone kind of changed a little bit. And a lot of us in the community, we noticed that, we sensed that. And it's just kind of sad that even, we still see this happening to our community in so many different areas. And once we were the ones that were predominantly affected or disproportionately affected, the tone in the media changed, the reports changed. It was so much stuff that changed. And when it first, to be honest, when it felt like that this was, they didn't see the difference in which communities was being affected, that sense of urgency, that sense of, fear was just on the minds of a lot of us. And then unfortunately, once those numbers came out, the tone of the media changed. And we still, and the same thing, I know we still going to talk about the opioid epidemic, the same thing that we saw with that. The media played a huge role in the crack cocaine epidemic, in mass incarceration. And now, since it's predominantly, you have more in the white community are being affected. Now the media, the tone has changed.
It's a crisis.
Opioid use disorder, it's substance use disorder. We're not saying drug addict. We're saying a person who used drugs. We're not saying crack babies or babies addicted to crack. We're saying neonatal abstinence syndrome. The whole tone changed. We're talking about harm reduction, teaching people how to safely use so that you don't overdose and die. But where was all of this support and positive media attention back in the 80s and the 90s? It wasn't there. We as Black people were portrayed as, dirty, immoral people, can't keep a job. This is how they portrayed substance use. And now, since it's it's a public health crisis as declared by the United States, and it's in the white community, now the tone has changed. And we tend to see that happening, unfortunately, in our community. When it spreads to the larger white community, the tone changes, more of a compassionate, sensitive type approach.
Yeah,
absolutely. I've been telling folks this. So I'm the manager of a training department with DMH. And we train CPR first aid. And so we started training on naloxone and Narcan. And I'm like, man, when folks was on heroin, where was this at? But being that you're so big in the helping with the opioid crisis, how has that impacted COVID? How has COVID impacted the opioid crisis?
Yes. Is really sad. So with the lockdown, we saw a significant increase in overdose deaths. So a few things that took place there. I talked to people about this. With the lockdown, the economy shut down. So there was a change in the drug supply. So there's a change in the drug supply. Somebody's now, they don't know exactly what they're getting. The fentanyl that was on the street wasn't really available too much, because typically they kind of come up from Mexico. Some may come down, ship down from Canada, but in St. Louis, Highway 44 is like the main highway. And so once the economy shut down here in St. Louis, the drug supply changed, and all across the country, actually. And then once those restrictions were lifted, the stay-at-home order was lifted, that also opened the economy. So now we saw fentanyl returning into the community. And what we do know, fentanyl is much stronger than heroin when we think about, the potency. And for some people, they think, stronger mean better high. It doesn't really mean that. It has to do with how it binds to the receptor. So someone who goes to a lighter opioid like heroin and then switch back to fentanyl and they think they're using the same, we just, set somebody up for an overdose. So that change in drug supply was really significant in the community. The stay-at-home order. So typically, with the Narcan training and the naloxone training, we tell people to use with somebody, have Narcan there. Well, if you're staying at home by yourself, you're not using with anybody, who will be able to revive you and save you? The other thing with COVID, there was a significant delay with ambulances getting to certain areas. And we already had delay in the Black community anyways. Mm-hmm. Now you add a pandemic on top. I was getting reports of hearing that it was taking a significant amount of time to respond to non-overdose calls in the community. So you had multiple different things that took place. So that area was substance use. We saw we were making some leeway, some improvement. When we really look at this information stratified by race, we did know even before the pandemic that Black males are being affected. Now, in the pandemic, we saw a substantial increase, almost a 2 to 3 increase in Black overdose deaths among our men during the pandemic. And that was pretty much that was seen also. So it's kind of like, with the pandemic, it made things worse with the substance use area with, increasing rates of overdose just because people couldn't social distance, so then you had certain communities in which COVID was spreading through the communities. So there was a lot. And I do think the pandemic itself was very, very devastating with those of us who work in this area with opioid use, but specifically in the Black community, we definitely saw a lot of people overdose.
Yeah. So it sounds like, again, that ripple effect that we talked about, excuse me, just really impacting so many other areas. And even with the opioid crisis, as now it's all, being framed as, we are just seeing that with COVID and with the restrictions, with the stay-at-home orders, with the quarantine and all of that, it's kind of like I don't know if it's like a bottleneck effect or, whatever, but it's making everything that was wrong before magnified now. Mm-hmm. So are there things, because I know we have to wrap up, are there things either nationally or locally that, because these things have been magnified and we're now seeing this is where the issue is, what local or national what is the word? Initiatives. Thank you. Local or national initiatives that you may be seeing that we can jump on board with to either help or to get the word out, to educate others, look into more. What can you speak to about that?
Yeah, so that's actually myself and a few. So Dr. Punch, we've kind of like joined forces along with folks over at UMSL, MIMH, as well as a few other partners like Regional Health Commission and Integrated Health Network. And we created this initiative called the Center Initiative, which is specifically supporting Black people who use drugs. That's exactly what it is. So how can we create a support system in place for Black people who use drugs, whether it's harm reduction services, connecting to treatment, being on the ground, connecting to resources, housing. So I think, that's one initiative that's new, is different, is community-based, community participatory with regards to substance use. There are some other initiatives. So a lot of the churches have come together to do, very vaccine type initiatives, partnering with local health departments to help get the word out. So that's something that they're doing on that aspect. Regional Health Commission, actually on their website, they have great information about the vaccine. They have a neutral approach to it. They lay out the facts and the information is available. So I think that's really great. If you want, it's not biased, is here's the information, this is what we have to say about it. There's a few other national campaigns as far as, the equitable distribution. You kind of see those popping up now. A lot of people's really talking about, how can this be equitable as far as the vaccine distribution? So a few initiatives with that. The state also has some initiatives as well. Deshaun, you was on that one that I was on with the, educating the community, educating a lot of the state workers across the state of Missouri. So multiple mini initiatives, a lot of grassroots organizations are also kind of stepping up the plate as well. And then I'll say a lot of medical societies also, a lot of information about, of course, training, anti-racist information, anti-bias information, doing a lot of teaching to providers in general on how to approach this subject. I mean, it's huge. And not only that, like I said, I do think with 2020, with everything that happened with George Floyd, it's sad that happened. But now, we're in a space now that we can actually talk about the effects of racism. We can talk about that, and the person who don't want to talk about it is now the outsider. Whereas before,
Absolutely.
you used to be the one who was the outsider. So this is a prime opportunity to be able to make changes in that, understand whiteness, understand white supremacy and its effects. So I think that's another huge thing too. You have a lot of businesses are now becoming more aware and using that race-based lens to focus on some things.
Awesome. Well, Dr. Turner, we want to honor your time. We told you we weren't going to hold you for more than an hour. There's so much more I wanted to talk about. I wanted to talk about booster shots.
This was so fun. Thank you for inviting us. I love talking about this. I love talking, especially in this setting. It's not a doctor's office is, we're chit-chatting. So I think it's
Yeah.
important.
Absolutely, absolutely. Well, maybe we can revisit some other things at some point. But if people want to connect with you, do you have social media where people can tweet you or
I saw
whatever?
that look. She was like, no.
I know. I mean, let's see, on Twitter, I think my Twitter is Kanika MD. I don't really tweet too much. I like to go on there and look, but I'm just not, I have to get on board with social media. I keep getting asked questions about my social media. And I said, I'm kind of low key. I don't really post too much, but maybe I should. But I'm happy if someone want to tweet me or send me something. I do reply.
All right. So you heard her. She says she replies. So if you have questions related to the content that she shared, or if you want to learn more, go ahead and look her up on Twitter at Dr. Did you say? No, you said Kanika MD. Okay, well, we will make sure we post it.
We'll put it right across the bottom.
Yeah, we'll put it so that everyone can follow along and they can follow you on social media and get in touch with you with any questions that you have. Because as you all can see, she is a wealth of knowledge. We appreciate you so much for being here with us on the Good and Well Soul podcast.
Thank you so much.
All right. So thank you so much for being with us. And that being said, we thank all of you who are watching, who are going to be watching when we post this up. And just thank y'all for our viewers, our listeners, and everyone. Because at the Good and Well Soul podcast, our prayer is that all may go well with you and that you may be in good health as it goes well with your soul. Thank you, Dr. Turner.
All right. Thank you.
All right.